This all began right after Katrina. I started passing blood. They did a CAT scan and it indicated I had a tumor on my kidney. Performed surgery, removed my kidney, and everything was fine for years. Then in 2016, they discovered a tumor on my bladder. They performed surgery on me, and I was being treated for about 1.5 years. And I kept complaining that my back was hurting and that my balance was off. I just wasn't right. Then I started passing blood. This was at another local hospital. The tumor board did some extensive scans and all together told me that I had maybe six to 8 months. That there was no way that they could perform surgery. And whatever they did for me was going to be very harsh side effects, and I'd probably still not make it. Having been in the Marines, I was taught to face adversity, and this was about as adverse as you can get.
When Mr. Veruso originally presented, he came in with severe back pain, and it was found that he had metastatic renal cell carcinoma that had spread to his bone. This is a terminal diagnosis, one without a cure.
I was told that I had cancer, which had metastasized in my bladder, in my ureter, in my abdominal aorta, in my abdomen, in my spine, and a psoas muscle in my back. Based on that diagnosis, they gave me very little hope, but they were not aware of the research that was being done at MD Anderson. I met with Dr. Tenier. I discussed my case with him, and he said, number one, we don't talk about a prognosis like that. We're constantly developing new drugs and new treatment. Tomorrow we could find a cure for cancer. Dr. Tenier said, well, rather than coming here for treatment, I've got a young doctor in New Orleans that's done his fellowship with me years ago, and if he'd want, I'll refer you to him.
He hadn't been given much hope before, and he was looking for another opinion. I think that's what he got when he saw Dr. Tenier and myself, and he was able to start immunotherapy.
When patients develop cancer, whether it's kidney cancer or other cancers, the immune system drops its guard, and then there is spread of the cancer to vital organs, which really, this is what Mr. Veruso had. He had stage 4 disease.
When I began my training, the treatment options for renal cell carcinoma really were quite bleak. We had interferon alpha and high-dose IL-2, therapies that were extremely toxic and worked at very few patients. Today, renal cell carcinoma patients have many, many options, including targeted therapies, immunotherapies, and combinations of those. And it also leads to better quality of life for our patients, longer lives for our patients, and overall better outcomes.
This therapy, this field of immune checkpoint inhibitor therapy and immunotherapy in general has revolutionized the way we treat cancer.
Because of being led to MD Anderson and then to Ochsner 5 years ago, I'm still alive.
Okay, good. Your heart sounds good. Nice normal rhythm.
The staff, all the nurses, all the physicians, everyone has been so compassionate and supportive in my care. It's just, I really can't say anything negative about it.
I think it's super important to have connection with your patients. I think that goes a long way into helping them stay motivated for treatment and for being able to go through the hard times as well as enjoying the good times together. And if you don't, you really miss out on a big portion of that cancer care.
Yeah, you're not just a number. You're a name. And you know who they are too. That's what it's all about.
And he stuck with me.
Yeah.
I love you. I love you.
I've dreamed of a partnership between Ochsner and MD Anderson for over a decade. What does this mean for our patients? Well, it really means that they can get the same care here in New Orleans as they would in Houston. And it ultimately means that we will be able to bring in research studies and clinical trials from Houston here to New Orleans to greatly accelerate cures and new treatments for cancer patients. When I drive up to the cancer center these days and I see the MD Anderson sign, it makes me feel proud of the work I did years ago when I was in Houston, and it makes me feel very proud of the work I'm doing here at Ochsner today, because I know that both institutions at their heart have as our principal goal the eradication of cancer.
I've just always been one to fight. I've always felt that you can never ever give up. My outlook is fantastic because I'm still here after being told that I'd be dead in such a short period of time. So every day is a gift. And I look forward to the future.